Sure. So me, and then you're, because Padua is not here, so
Okay.
you'll be after me. I'm just
Okay.
going for a few minutes. Won't be.
Okay.
You're good. Okay.
Sounds great.
Great. All right.
All right.
I think we're good. Yeah. We'll s- we'll start whenever you're ready. Let him move, and we'll. There we go. Okay, I think the truck's by us. All right. Good morning. Thanks for coming out. Excuse me. My name is John Gioia. I live in Richmond, and I represent West Contra Costa County, including this area, on the Contra Costa Board of Supervisors. And I'm here with Dr. Rohan Radhakrishnan from our Health Services Department and Abel Pineda from the San Pablo City Council. And I want to first welcome you to here to come early in the morning. I know you're going to get a chance to do some video, take some tape of the site. Starting at 8:30 today until 3:30, we are, the health department working with community members, is going to provide free COVID-19 testing, free flu shots, and some free groceries to those who would like them. And this is really part of our larger effort to work with the community to slow the spread of the virus and really be in partnership with community leaders. And this is sort of the first day of a countywide effort to have this stronger partnership. We've partnered with communities before, but this event is sort of jointly sponsored. You've all heard from our health department and others that while our cities and our communities, our hospitals, our first responders have made progress since the pandemic started, it is really important to have our community and community leaders be stronger partners. So really, this event was the result of residents in the Latinx community coming to the county and saying, we want to help sponsor an event that brings people out for testing. Testing does occur 6 days a week out here in West County. However, this event was more specially designed, and the outreach was done by both our community, the Latinx community, as well as by the county health department. So we really want to make this successful. So today the message is we're asking anyone, they don't have to be from the Latinx community, it can be anyone, to come down to our West County Health Center to get tested and to get a free flu vaccine. So officially the event starts at 9, although folks are set up about 8:30. No appointment or insurance is required. So from 9 until 3:30, the event will be going on. As I said earlier, groceries are available to those who need them, courtesy of community partners. What we are seeing, which is troubling, which is a trend that's happened all across the country, is that our hardest hit communities are our communities of color. In some communities around the country, it's the African American community. In others, it's the Latinx community. Here, the Latinx community has been the hardest hit, especially communities here in San Pablo and in Richmond, as well as other areas around the county like the Bay Point area and the Monument Corridor in Concord. The county and the health department have been committed over the years to reducing health disparities with the goal of not having any health disparities. So this extra effort is designed to do that, to eliminate our health disparities among communities. So it is also important that people who come and get tested and get information can help inform their friends and neighbors and tell their friends and neighbors the message about wearing a mask, physical distancing at least 6 feet. If you're sick, don't go out, get tested. And to really encourage neighbors and friends to get tested so we can understand where the virus is spreading and have the greatest impact on it. There are a number of things we've done here in Contra Costa to reduce disparities, and one of those that we're really proud of is a couple of years ago we created a program called Contra Costa Cares. We're working with our community-based clinics to provide health care to individuals regardless of immigration status. You do not have to be documented to get that health care. Because we understand it's important that everybody be healthy. We are all healthier when everyone has access to good health care, medical care, and when everyone is as healthy as possible. One of our strongest partners out here has been Lifelong Medical, which is a nonprofit, federally qualified healthcare system. They have several clinics, including one around the corner from here and one in downtown Richmond, and we work in partnership with them. So today, we want this event to be a model for organizing these types of services in other communities around the county where there's a great need. And today, the focus will be on safety, physical distancing, and that it is not fair to have disparities, and that's why we want to bring people out, and they will be moved through at a brisk pace in a safe way, so that they could get their tests, get their shots, and then move on to other areas. So with that, I'm going to introduce someone who really has been a great community leader, not just a council member. We think of council members, we think of just someone who's, sits up as a politician. He's not. He really comes out of this community. So many of us got to know him when he was active in a local youth center, the Rise Youth Center, and he is on the San Pablo City Council, Abel Pineda, and he has dealt with COVID-19 in a very personal way. And I think hearing personal stories is so important and moves us to really understand the importance of all of this. So, Abel, where are you?
Hello everyone, my name is Abel Pineda and I'm a council member for the city of San Pablo. I'm honored to join many of our community leaders in this mass COVID-19 testing event to stop the spread of COVID. I want to take a moment to recognize the resiliency of the public and our community members during these challenging times. We are facing a crisis unlike any other, and it is in moments like these that we need to stand together and support one another. By now, some of you may have already read and heard that members in my family were battling with COVID-19 just 2 months ago. I publicly shared my story then, and I want to share it now with the hopes of encouraging the public to take this virus seriously and to follow the public health guidance to keep ourselves, our communities, and our families safe. For context, I live in a small house with 3 others, and we share 1 bathroom. It all started with my parents not feeling well. My father developed a fever, night chills, and a cough. My mother was fatigued and lost her ability to smell. My eldest sister soon after too started showing symptoms. This concerned me, so I made arrangements to have my entire family be tested for COVID-19. I was the only person in my household to test negative for the virus. My second eldest sister, who lives across the street from me, also tested positive, but was asymptomatic. Her husband and 2 children tested negative. I want you to know that COVID-19 can be a very scary experience, both for the person who has it and those around them. I saw firsthand the effects that it can have on the health of those who contract the virus, and it is difficult to watch as the health of those you love deteriorate in front of you, and all you can do is provide limited help. I had to rush everyone in my household at least one time to the hospital due to health complications that COVID-19 caused. One of the nights that we were quarantining, I found my mother with watery eyes, her face was red, and she was gasping for air with every breath. The best way to describe what I saw my mother going through was akin to somebody who had held their breath for a long period of time underwater and was coming up gasping for air. I immediately drove my mother to the emergency room. My mother and I had a moment where we both felt that this could possibly be our last conversation. For people who have never had that type of conversation with your parents, it can be quite frightening. I couldn't hug my mother or join her as she was admitted to the hospital. It felt as if the final moments with my mother were largely filled with her inability to breathe. Thankfully, my mother was able to return home after a few hours of getting care. While my family was battling COVID-19, I spent most of my time helping monitor their health by documenting changes in their fevers, often checking their oxygen levels and heart rate, and seeing that they take their medication on time. I'm absolutely thankful to all the healthcare professionals who took our calls and helped guide us during these experiences. I understand that there are real challenges that exist in our community, but there are steps that we can take each and every single day to keep ourselves and others safe. One thing you can do is to come on by today and get a free COVID-19 test. Getting tested regularly is not the only thing we can do to protect ourselves and our families. Wearing a mask or face covering when you go out is important. It may not seem like it does much to protect anybody when you wear a cloth or paper mask, but more evidence is being published every week that says that masks save lives. Wearing a face covering when you go out or when you go near people that do not live in your household is an act of solidarity. The point is to protect everyone around you. Wearing a mask matters, even if you feel healthy, because you might not know that you are infected. As many as 1 in 5 people who test positive for COVID-19 in Contra Costa County had no symptoms. As someone who knows the dangers of COVID-19, I ask that you take part in being a part of the effort that helps stop the spread. Thank you.
Thank you, Abel. As I mentioned, leaders in the Latinx community, including Councilmember Pineda, have been really working to get the message out, and I want to acknowledge United Latino Voices, which really was the group of community leaders who recommended an event like this, working with the county, and then worked very hard to prepare materials to get distributed. In fact, there were door hangers put on homes in neighborhoods in Richmond and San Pablo in Spanish and in English, publicizing this event and getting the word out through networks. So I want to now introduce one of our frontline physicians, Dr. Rohan Radhakrishnan, who has been doing a lot of work, not just across the county, but focused also specifically on the Latinx community. Dr. Radhakrishnan?
Buenos dias, mi gente. Good morning, everyone. My name is Dr. Rohan Radhakrishnan. I'm a family doctor here in San Pablo and one of the deputy health officers for Contra Costa County. I want you to know that I'm not a lung doctor. I'm a family doctor and a community doctor, because this virus affects much more than our lungs. It affects our entire families and our entire community. And unfortunately, some communities more than others. 43% of all positive cases in our county to date are in families that are Latino. The trends are concerning. Just from 2 weeks ago till today, the number of hospitalizations has doubled. Compared to the rest of the county, in Richmond, the number of positive cases is double. In San Pablo, where we stand today, the number of cases is triple. That's not fair, and we can do something about it. Health is very local. It's not just your zip code or your census tract. It's actually your neighborhood or your actual housing unit. There are some households where if you get tested, you may be 4 to 5 times more likely to be positive than other households across our county. And the nature of this virus, who it infects and who it kills, is changing. In the first few months, we thought it was just the elderly. And indeed, more than half the deaths were in those in nursing homes. But since August, that has changed. And now more than half the deaths are in people living in the community and folks who are younger and younger. In fact, since the summer, more than half of all positive cases are in people less than age 50. For that reason, it's important that all people, young, middle-aged, and elderly, get a test, because knowledge is power. It tells us if we are infected with this invisible virus, with up to half the people infected not having any symptoms, so we can protect ourselves and our loved ones as quickly as possible. As one of your health officers, every morning I get an email, and it has the numbers and the names of those who have died from this virus. Now that number is in the hundreds, and every day I dread reading my email when I wake up. I used to deliver babies for 8 years in this county and sign birth certificates. Now I've had to sign death certificates, including for my patients at this clinic here. We're in for a long haul, but there is hope in partnership and in resources and knowledge that is in our hands. We have a lot of tools at our disposal, and today marks the beginning of a new and deepened partnership with our Latino community and with many community members and partners to make sure we have a holistic approach to this virus and this pandemic that will go on well into next year. So it's not just a swab in each nose for 15 seconds. Testing is just the beginning. There's a lot of fear to get tested because it may mean you have to be apart from your family and you're a caregiver for a young child or an elderly family member. Your income is essential to paying rent and keeping food on the table. That's why, if you test positive, our team that reaches out to you offers a variety of resources, not just the knowledge if that test is positive or negative, but you get a human that can speak many languages with our translation services and get you the help you need. That may mean access to a free hotel where you can separate from your family members and have your own room and bathroom to safely quarantine or isolate and not infect your family members. That may mean linkage to lawyers and job services to make sure you get your rights for your sick leave and wage replacement if you have that for you. Beyond testing, we have a lot to offer, and today marks that commitment. We're here with food, we're here with knowledge, we're here with face masks, we're here with flu vaccines, we're here with community partners and health specialists to answer your questions. We want you to know that if you are an essential worker, thank you. You have been sacrificing your life and your family to keep food on the table, to keep essential resources flowing in our communities, and you are at higher risk, which is why since July we've recommended all essential workers get a test every 30 days. Make it the new norm so you know if you have that virus, even if you don't have symptoms. As we head into the holidays, we are concerned that numbers could rise. Colder temperature, more time indoors, less ventilation and air circulation, more family gatherings. For all these reasons, we need to up our game in terms of prevention and testing. Here in Contra Costa County, we have 13 community testing sites. All are free. They don't ask you your insurance. They don't ask you your immigration status. It will not be considered part of public charge. And if you get that positive test, we'll offer you a suite of resources to keep you and your family safe. Call 1-844-421-0804 or go to our website, cchealth.org, and you can sign up online to get a test. This summer it was difficult. Testing could take more than 10 days to get a result, but now you'll get a result in 1 or 2 days, called or texted to you. Knowledge is power. It helps you know that you're safe and won't infect those that you live with and those that you love. So, I'm also here to tell you that we have a commitment to health equity for all communities that are disproportionately impacted. And we have a commitment to workforce diversity, so you have a staff serving you that looks like and talks like the residents that we serve. So before I answer any medical questions you have, I'd like to briefly introduce one of our newest doctors, Dr. Neri Guerrero, to share her perspective working in this clinic serving the Latino community. Please welcome Dr. Neri Guerrero.
Hi. Buenos dias. Good morning. My name is Neri Guerrero, and as mentioned, I'm one of the doctors with the Contra Costa program. I'm originally from South Texas, bordering Reynosa, Tamaulipas, and Mexico. Majority of my family is from Mexico. My community is there in the border. And I've recently had the privilege to work as your doctor here at the clinic and see your patients at the Martinez Hospital. See our patients in the Martinez Hospital. We've seen how COVID, the virus, has affected our community, our Latino community, not only at home where I'm from, but also here, everywhere in the country. And as a doctor, I've had the privilege of caring for patients, and I've seen essential workers come in as well with COVID positive. I recently took care of a patient, and besides seeing them in the ICU and checking their vitals and all of that, I also talked to their family, and I understand the scary feeling that comes with not being able to see your family, sometimes not even understanding what the next step is. Not only am I a doctor, but I'm also a daughter, I'm also a sister, I'm part of the Latino community, and I understand the fear, and I understand sometimes the mistrust with different information and sometimes the medical system. But I also know, as been mentioned before, that knowledge is power, and having this free resource really gives us the power as a community to help each other, to help maintain each other safe. As a doctor, your documented status means nothing to me. We care for everybody just the same, and we want everyone to have the same resources. So hopefully, if you do get to come today, you also share the knowledge that there's rooms for you to stay, that you won't lose your job because we're here to help you with all these resources. So I really hope we see a lot of our community come out, get testing, share this information, because we can empower each other and help each other get stronger, be healthier. Thank you for letting me be part of your community and your doctor.
So I want to end by telling you the 5 key words that will keep us safe and protected as we head into 2021. Face, space, hands, home, test. Face, space, hands, home, test. Face, cover your face. If 95% of Americans would wear a mask, we would save 100,000 lives by February. It can be considered more effective than a vaccine. It's essentially free. We're handing them out to you today. It is in our hands to model and be the residents that protect ourselves and others by covering our face. Space, 6 feet distance, now and well into next year, is key from preventing those invisible droplets when we talk or speak or eat or drink from infecting those who we love. Hands, old school public health, soap and warm water, 20 seconds, goes a long way and does get rid of this virus. We don't need fancy chemicals. It is enough to keep us with the virus off of our surfaces and not touching our face to infect ourselves. Home, staying home when we're not feeling well. This is our obligation to not go to school, not go to work. If we are feeling sick, it's essential to protect the people we love. Finally, testing. Today we want to add that fifth component of prevention because now it's readily available, it's free, and we're bringing it to you today. Testing is the newest part of our prevention strategy, which is why we're coming to the community with our partners to overcome concerns, fears, and barriers to let you know you can get a result in 1 or 2 days, to be empowered with the knowledge to protect your family. I finally want to end by talking about the flu vaccine, because while all of us are waiting for more studies on a coronavirus vaccine, we have an amazingly powerful flu vaccine right now, right here. Come on down, you can get it for free today. Influenza kills tens of thousands of Americans every year. There are more than 100 subtypes, and the vaccine this year is very effective. We see the data from the Southern Hemisphere. It has 4 strains, and it can and will protect you against that other respiratory virus. You don't know if you'll have COVID or influenza, but it's the best way to protect yourselves with the resources that we have. Thank you.
So with that, do you have, if we're open to any questions to anyone here, if you have any questions? Okay. All right, so thank you for coming, and I know Kim will take you around or advise you on the best way if you want to get some footage and film. So thank you for coming, and thank you for really helping publicize this important community event.